The committee meetings are held in public session, so please switch off mobile phones and Blackberries as they interfere with the recording equipment. Apologies I've received. David McElveen, are there any other?
Gordon Dunn.
Thank you. Under Chairperson's business, I would like firstly to raise the issue that was reflected today in the local media again around the tax code issue for sizable numbers of medical staff. There is a suggestion today that both the BSO and HMRC are working actively to try to resolve this situation. But there is certainly a view that there is a need to resolve this before the 19th of this month to ensure that the payments issue is resolved and doesn't reoccur next month or indeed ongoing months. So I think that this committee, it would be fitting to seek a view from the Minister and the Department about what pressure is being brought to bear to make sure that that happens, because it's turning into an extremely hard and difficult situation for huge numbers of employees who are trying to hold down very important service and deliver a very important service. So I'm asking for members' agreement that we seek that view from the Minister as to what progress has been made with regard to that timescale.
It's more than just the tax code. I mean, it's clear that overtime payments are outstanding for 3 months. I mean, in most systems there's a manual override, there's a mechanism for allowing adjustments. It would appear that they have no mechanism, whatever. I don't know what system they put in. You know, something urgently needs to be addressed so that staff are getting paid for work that they've carried out.
Thank you for that. Agreed, membership.
Is there any connection with this? You know, the way they changed to centralise some of the management services, and payroll was one. And I attended a meeting in Armagh where they're sending people to Ballymena and different places, and it was flagged up at that time that it was going to lead to difficulties. I'm just wondering, is that all part of it? They seem to be just blaming HMRC and you know, the services, but there has to be more to it than that.
Yeah, and I think that, I mean, it certainly does seem to be connected, that this is part of the new shared system services that was implemented that's causing problems which have been flagged up, but problems that are causing real hardship for people now. And yes, we do need to get a sense of what is going wrong with the system, how it's going to be rectified before the next payroll is issued, and how we can get guarantees that it won't happen again. If members are comfortable with that, we will do that. Also want to remind members that on Wednesday the 4th of June the committee will be visiting the Pavilions development in Lisburn as part of our review into supported living for older people. The visit will start at 10:30 a.m. and members will return here for 12 noon. The committee will meet as normal in the afternoon, and transport has been arranged to leave here at 9:45. So can I ask members, on your tables there are pro formas indicating if you are available to attend and if you require transport, just to complete those for the committee.
I think I'm returned there. I'm in London at that date, so I'll not be here.
Thank you for that. Okay.
Chair, could I apologise as well? I have an ABG on infertility which I'm chairing, and it's clashing. It's 11 o'clock on the same day, so I'll not be able to go.
Okay, thank you for that. Okay, I just want to also advise members that the final agenda item today is the committee's review of waiting times, and given that the committee will be evaluating the evidence received to date and discussing possible recommendations, I'm seeking agreement as per normal to hold this part of the meeting in closed session. Great.
Great.
Thank you. Item 3, members, is the draft minutes of the meeting on Wednesday the 30th of April. The minutes held on 30th of April are at page 6. Can I ask, are members content with the minutes? Great. Yeah, thank you. Item 4 is the review of transforming your care in older people, the evidence session with AGNI. I just again want to remind the committee that last week members visited Cedar Court in Downpatrick. I think it was a very useful visit, and there was a number of key messages. It was clear that there was an enthusiasm, I suppose, from tenants and also staff in relation to the model that allows people to retain their independence. It's probably safe to say that the facility itself would require that tenants would have a degree of independence. And I suppose the other issue was the fact that there are vacancies in such a good facility. Around 16 of the 24 apartments are currently taken. So that would seem to suggest that there's a need for more promotion and more awareness of supported living as an option. And that's a message that we have been picking up through other evidence sessions as well around choice. So are there other members that want to comment on the visit or maybe the key points that were picked
Madam
up?
Chair, could I just, do we write or have we written thank them for their cooperation and the excellent accommodation they do provide for the senior citizens?
We haven't done, but I think that would be appropriate to do that. I think
I
you're
would
right,
welcome
yes,
that.
because it was a very useful engagement at all levels. Okay.
It's clear from the residents that we spoke to that they were very contented with the setting that they were in, and certainly it seemed to be very impressive and well thought out.
Okay, thank you. Okay. I want to refer members then to the briefing paper from AGNI on page 11. Also want to refer members to correspondence from Cardi at page 22. They had been invited to give evidence today alongside AGNI, but felt that they would be unable to comment on the issue of supported living, given that they hadn't done any research into it. So can I ask members to note a response also from the Northern Trust on its budget for supported living at page 23. Folks, you're very welcome. We have Judith Cross, Strategic Policy Advisor, Health and Social Care, AGNI, and Dwayne Farrell, Director of Policy, AGNI. You're very welcome. I just want to advise you as witnesses that the committee has obviously read through your briefing paper, and thank you for that. We have also noted that it is very broad in its scope, and there's a lot of detail provided on important issues, obviously such as domiciliary care, and issues like community meals, for example, but we want to be very clear that the focus of our particular review is on supported living for older people within the context of TYC. So we're just mindful of being able to maximise the time that we have with you as best we can. So the normal procedure here is that we would ask you to make a 10-minute presentation and then just invite the questions from members.
And I hope we may be able to do better than 10 minutes for you and move to the substantive points of questions and answers. First thing to say is thanks, Chair, and thanks to committee members for inviting us here. We welcome the opportunity to give evidence to the committee on key issues for older people and transforming your care, particularly around enabling older people to remain at home. We understand that the committee are looking at the scope of this, and we're on this review in assisted living, and we're happy to provide evidence. I suppose just quickly to say something about AGNI. AGNI as a regional organisation over the last year has had about 125,000 engagements with older people across our domiciliary care, our day care, our residential care, as well as the work we do with older people's groups and networks across Northern Ireland, and the advice that we provide through our advice line. So we comment on the evidence we provide is on that basis. Older people have been clear. They want to remain at home and die at home where possible, and given that this is Dying Matters Awareness Week, it's probably quite an important point to make. We have engaged with many of you as individuals and as committee members and through your parties, and many people have given us support for AGNI's vision of social care. We talk about quality, integrated social care that recognises the rights, aspirations and diversity of us all, and is based on the right to live with independence, dignity and choice and security. We've welcomed the vision of transforming your care. Home as the hub of care is what older people want for themselves, and we have been very active throughout the process around transforming your care, making a series of recommendations to enable this to happen. Home as the hub, as a concept, like everything, doesn't happen in a vacuum, and housing is a vital component of enabling older people to remain at home and central to the transforming your care vision. It's probably important to say at this stage that we are not a specialist housing care provider, but our evidence today highlights how the importance of services and housing options for older people are pivotal if we are to realise the vision in transforming your care to to enable older people to remain at home for as long as possible. Just by way of establishing some context, the arguments are probably well rehearsed, but it's always important to point out demographics. We are living in an ageing population that's not as healthy as we would like, and levels of disability significantly increase with age. Poverty and fuel poverty are rising. Levels of pensioner poverty are while stabilising, we have a view that that's about broader issues. High levels of owner-occupier and higher levels of older people in nursing and residential accommodation when compared with England. We also highlighted the current situation how social care is provided across Northern Ireland, and probably important to flag up our concerns about how services are potentially being rationed on the basis only meeting high, critical and substantial levels of needs. We know that enabling older people to remain at home does not happen in a vacuum and is a responsibility of more than health and social services. DSD and housing are a significant factor. However, the capacity for health and social care to deliver on a range of social care services to enable older people to remain at home or in a supported housing environment is seriously called into question, as we believe the evidence in our paper shows. AGNI makes no apology that any discussion of future housing options must include older people as part of that debate. It's about choice. In order to live at home and for home to be the hub of care, you need a decent, suitable home in which to live. Yet we believe this aspect receives little or scant attention in public policy. The evidence is clear that bad housing has a knock-on effect for the NHS and other areas of public policy. Many of the chronic conditions experienced by older people have a causal link to or are exacerbated by particular housing conditions. The context section that we included in our paper shows that a great number of older people are living in fuel poverty, increasing numbers of the older old age cohort who are likely to need care and support, increasing levels of ill health and chronic conditions amongst older people, coupled with restrictions in care packages and the proposed reform of funding of adult social care through Who Cares, potentially make for a perfect storm. The committee will be aware of AGNI's call for a regional prevention strategy led by the Department of Health, as we believe that prevention in many instances is the key to promotion of good health and a reduction in health inequalities. For older people, investment in preventative social care services is cost effective, can increase their quality of life, and housing needs and solutions should be part of any regional strategy. AGNI believes that a regional prevention strategy can reduce the need for provision of social care both at home and in a care home setting. It can reduce attendances and admissions at emergency departments and enable older people to remain at home where they want to be. A regional preventative strategy driven by the DHSSPS, but including departments such as DSD, has the added advantage of bringing together the key elements that we can ensure supported housing in all of its forms is what older people want and desire for themselves. The point I made earlier, the voices, experiences and desires of older people must be central to any discussions on supported housing options. I think they're probably the useful key points to start off on. Sure.
Okay, thank you, Joanne, for that. I suppose just picking up on the overall message is around the voice of older people in terms of issues like supported living. And I suppose one of the issues that we have been confronted with is through this inquiry has been around choice. And I mean, we have learned just very recently around vacancies in facilities, and we visited one of the facilities last week in Cedar Court in Downpatrick, and I think we would all be in agreement that it was a really modern, vibrant facility with quite a number of characters as tenants there as well, and they seemed to be really benefiting from that particular model of care, and the staff seemed to be very enthusiastic about the model that they were delivering, but there were still vacancies within the facility. And I suppose the question that I'm asking is, do you think then that there is that general lack of awareness among older people about supported living as an option? Are you coming across that?
I think anecdotally, I think that's a fair comment to make, that there is a lack of awareness, and I think the committee has also had discussions about how we use language and the terminology of supported housing, sheltered accommodation, and the confusion between those models. Very clearly, I think folded sheltered accommodations, spaces like that, there is a greater awareness of. But the more specialist housing models, housing with care models, I think there is probably not a huge amount of awareness among older people.
Okay, okay. And one of the things in your paper that jumped out at me was around the care assessments and the fact that, and I'm putting this in the context of supported living, and I'm staying on that as an issue, but that they've actually been decreasing.
Yeah.
And you know, is there a rationale for that, or?
Well, we have asked the board to explain this, and they haven't actually been able to. I mean, our view is that we have an increasing her old numbers of older people, but yet, as you can see from the chart we have, the number of actually domiciliary care assessments are actually going down. And we know from evidence from, again, as Dwayne said, from Hannah evidence that actually trusts are only meeting critical and a substantial need. So those people who in the past would have been entitled to some form of actually low-level help aren't even being assessed. Our sort of advice line also has evidence where older people are being told, well, we don't provide that type of service anymore, and that is services that they actually are supposed to be providing. So trusts seem to be actually cutting back on the number of actually packages.
Okay. And do you see, in terms of that care assessment,
Yeah.
what issues like supported living, should they be factored into those assessments?
They should be in the Northern Ireland, the Northern Ireland single assessment actually tool should actually capture the need for some sort of supported living if the older person is in a house or that isn't actually suitable. So they should actually capture that, yes.
Okay, okay. And one of the things, again, that the committee has been discovering throughout this process is, I suppose, there's a more strategic issue around the ageing population, and the fact, and certainly from the Older Persons Commissioner as part of their evidence session, that there wasn't clear plans or projections. There wasn't even, in essence, a clear definition of what supported living was, but there certainly wasn't clear plans or projections available from the department. Would that be your sense?
Absolutely, and I suppose I would go back to the start of this assembly term. We believe population ageing is a brilliant success, but requires policy, planning, and housing and health, and the interface between housing and health are one of those areas. We asked at that time that ageing be seen as a key driver for the programme for government to drive the types of changes that were needed and the culture changes that were needed in policy and services. So absolutely, population ageing is to be seen as a success, but what that means in terms of the policies and the challenges that are faced in our society, housing is one of the areas, and that interface between housing and health is one of those areas that we have to see that come through in terms of planning, policy planning and service planning.
And is there any sign that that is now shifting? Is there any sign that organisations like yourselves are in the room in terms of projections or planning, or?
In different spaces we are. We've been very heavily involved in health and social care in the department's work around Who Cares, and also in the Health and Social Care Board consultation around transforming your care. We are probably less so in those spaces in housing, but that's not a surprise to us. Housing is not a particular and discrete focus of Age and Eyes. Okay, okay. Well, finally, just your views on, again, in transforming your care and then the implementation plan. The whole notion about supported living and the development of supported living, it was suggested that it would reduce the need for statutory residential homes. What would be your sense of that?
Well, I suppose there is a sort of view sort of that a lot of people who are in actually residential care could be easily actually cared for in some sort of a supported actually living in sort of environment. But for AGNI, it is about actually choice, and it is about the choice of older people. Our view is that there will always be a need for some sort of actually residential model, and I suppose our view is there's a need for different models for across the age spectrum. There's no one model that will do it all. There has to be actually different models of housing need for older people, just as there are different levels of housing options are for the whole community. It can reduce the need for actually residential care, but I would be concerned that they would say that there's no longer a need for that residential actually model of actually care.
Okay, thank you. And I have a number of members had indicated. Kieran first.
Yeah, Chair, thanks very much for your presentation. How effective is the collaboration between the Department, the Board and housing associations in planning for the future in relation to supported housing? And Dwayne, I think you mentioned, and actually spoke about it, that it's important, indeed vital, that the senior citizens themselves have an input, a very strong input, into what type of supported accommodation they require. How you find that? How would you assess that? Both of those.
There's two questions there, Kieran, and I suppose in light of what I had said, that housing is not a specialist area of AGNI's, I probably feel slightly ill-equipped to comment authoritatively on your first question, how is collaboration happening between housing executive housing agencies. On the second point, in terms of participation, I feel a lot more equipped to be able to answer the question, and I think we have a significant journey to travel on how we effectively enable the participation of older people. I will quickly say AGNI operates an initiative called Peer Facilitators. They are groups of older people who we have trained in facilitation skills, in listening skills, in reporting skills, and who go out and engage with older people in the community and feedback to us on the issues that are there. They have spent the first 4 months of this year in residential and in nursing homes across Northern Ireland, listening to the voices of older people in those facilities. It is not a straightforward process. There are people living with complex needs, there are people living with cognitive impairments, and communication skills required to do that are significant. Also, you know, when we are potentially running consultations, the questions that we ask on policy consultations are complex and not the easiest for older people to engage with. So I don't think there is a strong culture of participating with people, particularly people with complex needs, in a way that allows them to participate effectively. AGNI and others are looking at innovative ways that we can bridge that gap, but a lot more work has to be done if we are serious about meaningful engagement and participation of older people in service design and policy development.
But you would agree that it's important that the older people, senior citizens, are in actual fact consulted as far as are possible so the provision can be made.
We believe it is a fundamental element of a rights-based approach.
Yep. Okay.
Can I add? It is also a significant part of ASSI Section 75 of the ASSI Northern Ireland Act. They have to ASSI consult. So. All right. Right. Okay. Good. A legal ASSI duty.
Good. Thanks very much. Thanks, Chair.
Okay. Thank you, Kieran. Mickey.
Yeah. Thanks for the presentation. You did mention about the type of housing can impact on the person's health, obviously. And I think part of the difficulty is a lot of older people live in rural areas where housing really isn't fit for purpose. And it seems to me, I'm on the DSD committee as well, which does deal with housing, that supported housing is not really being built as much as it should be, so that there's a dearth there. And I think they are, and I know you've answered one of the questions that the Chair asked. When the Older Persons Commissioner was appointed, the argument was that they would be at the heart of policy making for older people. And that doesn't seem to really have happened that much, and I think it's people like yourselves, and that should be an integral part of any kind of policy decisions affecting older people or senior citizens, as Sam referred to them as. The other thing, irrespective of what type of housing you have, people need enough money to live on. Now, at the moment, it's projected people £145 a week, something in around that. That falls short of about by £30 approximately of what was projected 3 or 4 years ago that a person would need to live on to have a reasonable quality of life. And therein lies part of the problem. I think because you could have the nicest house in the world, and when we talk about fuel poverty, it's about poverty. If you know, it doesn't matter what sort of a heating system you have, if you can't afford to put oil or gas into that system, then forget about it. And that's part of the difficulty, it's an inherent part of the difficulty that older people face. And, you know, in terms of housing associations, there are very few of them look to lifelong housing. You know, that when they are building them, where you have wider doors and the facility for ramps, facility for lifts and, you know, walk-in showers and all that. So the forward planning is very, very much lacking. But ultimately, the amount of money, I mean, we have one of the meanest, if not the meanest pension systems in the developed world. And that's the reality, and people need to be aware of that, because you can provide all the services and all, but if people haven't the quality of life that they need and deserve in terms of their actual income. Because if you have enough money to live on, then it creates an independence. It you know, reduces social isolation. It helps the quality of life. It helps people to live longer. It gives them a better quality of life, and I think that's important. And, you know, just maybe like you to comment on some of that.
Okay. There's a couple of areas there. I suppose from H&I's perspective, the more people who are campaigning, advocating, bringing the voice of older people to the fore, whether that's Older People's Commissioner, age sector organisations, whether that is specialists in housing with a focus on older people, we believe that is to be welcomed. There is a huge interface, and I appreciate that the committee has a very specific focus in supported housing and on this issue. Some of the points you make are absolutely valid and important. The interface, I think the ageing strategy, which Office of First Minister and Deputy First Minister have out for consultation at the moment, indicates that 1 in every 230 older people, the house that they live in fails to meet decent home standards. Now that is obviously going to have a knock-on impact on people's level of health, people's ability to live independently and live, you know, a decent quality of life. So there are interfaces, and I suppose as this committee takes forward its role, looking at those broader interfaces with Department of Social Development, with a range of policies is quite important.
Okay. Roy?
Again, thank you for your presentation. You've indicated that you've facilitated engagement with older people over this last number of months. What level of knowledge did you pick up do older people have of what is supported living?
We didn't consult with them on the ESI concept of a supported living. We were working with older people in the ESI statutory ESI residential homes, and we also were working with older people who live in nursing homes, because the department is currently looking at ESI reviewing the Massey standards for certain nursing homes. So that was the ESI reason we were in those facilities.
Have you had any wider discussions beyond that about what exactly supported living is?
Yeah, not on supported living. What we have had conversations with older people about is what is their home to them. Mm-hmm. And for some older people, it's important to flag up it is the home that they are currently in. Mm-hmm. But actually for a larger swathe of older people, a home is a more nebulous concept that is about their links into the community, that is about their ability to live independently, to engage with the resources around them. So I think that indicates a more flexible approach to a spectrum from the building that I am in to actually a place where I feel valued, where I feel safe and secure.
Okay. One of the aspects of supported living where it exists in Northern Ireland is in very limited geographical locations. How important is it for older people who may need supported living to be able to continue living in their own home, to have access to the local community and friends and family and issues down the street, etc.?
It's hugely important in our work with older people living in residence. I don't think it's unique to supported living, but that ability for, in a world where I suppose our families become a bit more geographically diverse, the ability to have people in close contact, to the point I made just a minute ago, is essential to people feeling safe and secure. I suppose on a broader level, Age and I believe that access to certain services should not be a postcode lottery. You know, if we're serious about supported living being a means to enable older people to remain at home, there should be ability to access that wherever you are.
Would you accept, in terms of planning for the future, it's also important to consult those who are still in their own homes?
I think that speaks to the point that we made earlier, that the voice of older people should absolutely be central, whether that own home is currently residential, whether it's a nursing home, whether it's their family home that they've been living in for a number of years. It should absolutely be central. And that's a challenge. I think that provides a challenge to policymakers and service developers, because I don't think we have good mechanisms to do it.
You know, as particularly someone who's involved in policy making, yourselves as representatives of older people, do you have a clear definition of what is supportive living and what is, you know, just an older person's home?
No is the straight up answer to that. We don't have a very clear definition. We feel terms are used interchangeably to describe old,
Sheltered.
through to the
Assisted
Mullineux,
living.
Sydenham Court type model, which is probably what we would more fully
As do some others.
Yeah, and I think that's probably part of the problem too. Yeah.
And I think, okay, no other members had indicated, but I think you're right. I think that is part of the issue. And, you know, how are we supposed to plan and project and forecast for types or models of accommodation that we haven't properly defined? And I think that's the real challenge coming out of this. But I want to thank you for that. It's been
Just one
Yeah,
point,
Mickey.
just in terms of the definition of supported housing and all, I mean, I attend the Pensioners Parliaments, and supported living doesn't really feature as a major topic, and I think that's indicative of the lack maybe of understanding of what it actually, you know, because people will talk about fuel, they'll talk about the amount of money and stuff like that. But it's such a core element for people, you know, as you go forward into the future, that supported living and supported housing is such an important issue. It doesn't really seem to, I'm interested, maybe it does indicate the lack of understanding of the definition of what it actually is, and maybe it's time that a more definitive assessment was done of what it actually means and what it is for people.
I mean, it's probably actually similar to the whole issue of actually care and actually residential homes and actually domiciliary care. You only tend to deal with it when it's your own actually personal circumstances. And again, our advice line gets lots of calls around people who just find the whole actually situation actually baffling. They find it confusing around what they're entitled to around actually social care, domiciliary care, and my instinct tells me around supported housing is probably exactly the same. You only deal with it when you know you have to.
I think that's a challenge for all of us to get that message out, you know, because there's so many different types, and it's really trying to tailor individual needs to the individual type of supported living or supported housing that the person needs.
Yeah.
And that diversity, I don't think, is that clear to people, that there is a diversity there, because they tend to think of, when I've spoken to people, you're in a sheltered accommodation with a warden or something, or a fold type. But I mean, that place, Cedar Court, that we were in last week, is such a refreshing.
Yeah.
But there's so little of that available, and therein lies the problem. And then again, of course, it's under-occupied, so it creates even more problems as to why is that? You know, you do wonder. You know? So it's a challenge, I think, for all of us.
okay.
Thanks.
Well, again, thank you both, and that was very informative for us. And I think probably the messages we take out of that is the need to have the clear definition, first of all, of supported living, and second of all, the voice of the older population to be included in processes, and the need to forecast and plan. So thank you for your time. Thank you.
Thank you.
Members, moving on to item 5, which is a proposed statutory rule, the Pharmaceutical Services Amendment Regulations. Referring members to page 26. The purpose of the statutory rule is to implement new arrangements for the independent prescribing of drugs and appliances by chiropodists, podopterists and physiotherapists. Are members content for the department to proceed with the statutory rule?
Great.
Thank you. 6 is another statutory rule, the recovery of health service charges. Refer members to page 31. We had considered and approved the SL1 for this rule at our meeting on the 12th of March. So were members content with the statutory rule?
Great.
Okay, I'll put the motion. The Committee for Health, Social Services and Public Safety has considered the recovery of health service charges and has no objection to the rule.
Great.
Item 7 is another statutory rule, the Draft Council of the Pharmaceutical Society of Northern Ireland Indemnity Arrangements, Regulations 2014, page 41, and refer members to. We had considered again and approved the SL1 for this rule at our meeting on the 30th of April 2014. Are members content with the statutory rule?
Great.
If so, I put the motion. The Committee for Health, Social Services and Public Safety has considered the Draft Council of the Pharmaceutical Society of Northern Ireland Indemnity Regulations 2014 and has no objection to the rule, subject to the report of the Examiner of Statutory Rules.
Great.
Item 8 is a forward work programme. I'm asking members to note the forward work programme, which is on page 51. Item 9 is matters arising. Under matters arising at page 55 is a letter from the Minister confirming that the officials will brief the committee on the Adoption and Children Bill prior to public consultation. So the clerk will liaise with officials to arrange a date for the briefing. Are members content to note this?
Great.
Page 56 is a response from the Minister about setting up an air ambulance service. The Minister states that an emergency aeromedical service has now been established in the south. A group was then established in December 2013 to look at the potential for north-south dimension to the service. I would suggest, members, given that this is something fairly new in terms of thinking, that the committee would write back to the Minister to ask for the terms of reference for the group, its membership and when it's due to make recommendations. Suggesting also that the Minister's response is copied to the Rural Community Network, who had raised this matter at the stakeholder event.
Great.
Page 57 is a response from the Minister regarding the falls prevention strategy of 2004. The Minister states that the Department hopes to publish an accident prevention strategy before the summer recess. So are members content to note and copy the response to Cardy, who had raised this matter with us?
Great.
Thank you. Page 58, 9.4 is a response from the Minister about services for people with diabetes.
Madam Chair, maybe this might be an appropriate time to read something that several members of this committee have been briefed on. I attended this morning a fascinating presentation about a new form of monitoring and treatment of those with both type 1 and type 2 diabetes, which could potentially revolutionise how we treat this long-term condition. I attend scores of these things, but this one this morning was, I think Roy was there as well, that was particularly impressive. I understand that they're going to write to the committee and seek to give us a briefing, presumably at the normal sort of speed dating, as I call it, session. I would urge the committee to consider accepting that and maybe even writing to the department to make them aware of this change. And it's already introduced as an experiment in the South East Trust, and it seems to be going exceptionally well. And I just think this is one of these ones that the committee should take an interest in.
Okay, right, yeah.
Yeah, you know, again, when we were given a brief by the principal consultant in the southeastern area looking after diabetes, along with a patient who's been on the scheme, I think, for 18 months. And certainly very, very positive feedback from a very senior clinician. And I'm actually a bit surprised that it isn't actually mentioned in the letter from the Minister, because it is a pilot that is out there where they certainly the Southeastern Trust is cooperating, and I understand other trusts are looking at widening pilots already, but there's already a sizable number of people here on the scheme and bringing particular benefits which are recommended by the principal diabetics consultant in the trust area.
Just to say to those who weren't there, I think 4 of us have had this briefing. This little box measures your blood glucose level and then tells you how much insulin to use that day. Saves you contacting either the nurse practitioner or the doctor. It tells you automatically what you need, and therefore you can adjust your insulin to the right level on a daily basis, therefore reducing the amount of insulin you require and also stabilising your condition quite considerably. and it would be appropriate for about 14,000 people in Northern Ireland could use this technique, and I think it's something definitely worth further investigation.
Okay, yeah, I had the opportunity as well to meet with them just previous to this meeting, and there's no doubt that it's an impressive piece of technology, and I think it would be right. I think it's Roy's point as well, it is, I suppose, surprising that it's not reflected in the response on the work around diabetes, but nonetheless I agree with the Deputy Chair, we should be writing off to seek clarification on how this has been progressed throughout the trusts, and accept the invite, I think, as well for the presentation to the stakeholders event.
Chair, can I ask a question? I mean, I wasn't at it, but I had representation made to me by patients. And is there a cost to this? And I mean, as far as I know, there is, and that's what perhaps is the delay in bringing something forward. I mean, if I can remember right, it was £275 for 3 months or something like that there, and the funding was not forthcoming. Does that
well,
make sense?
The total cost of every one of the 14,000 people took it is £30 million. But there's of course an immediate saving, quite significant saving in insulin and blood sugar tests. But yes, that will be an issue. There's no question about it, and it's worth. I'm not committing anybody to anything. I think we should just have a look at it, because it does seem to have amazing results in terms of the patient outcomes.
Well, I would certainly support that, given the information that was given to me by a patient.
Okay, yeah, I mean, I think that's right. We are seeking how that's been progressed, and all of that will involve the cost and also the evaluation of such a scheme as it has been rolled out in the South Eastern Trust, and there's an evaluation that has taken place there, and indeed the health outcomes that come alongside it. So, I mean, it's us seeking clarification and more information from the department. Okay, we also want to just share that letter from the Minister with the organisation. I think it was Diabetes NI who had raised the matter with us. So I think it would be appropriate to do that. Page 66 is a response from the Minister about hear loss issues. Are members content to note and copy the response to Action for Hearing Loss, who had raised the matter with us?
Great.
Okay, thank you. I'm asking members to note item 9.6 on page 68, item 9.7 on page 70, and item 9.9 on page 3 of the tabled items. This is our responses from the Public Health Agency on public awareness around leukemia and lymphoma. Are members again content to note and copy the responses to leukemia and lymphoma NI who had raised the matter?
I think some of us are attending an event tonight in the cancer unit in Belfast City Hospital on that very issue. At least I'm going. 6 o'clock.
Okay, thank you. Page 72 is a response from Una Crudden about the Minister's decision to pursue a general cancer awareness campaign rather than a standalone campaign for ovarian cancer. Una is advising that while she would have certainly preferred a standalone campaign, that she would be attending the stakeholder meeting that was due to take place last week to begin the planning for a general awareness campaign. So are members content to note that?
Yeah.
Okay. Item 10 on page 5 of the table papers is a letter received by Ciara McCarthy from the Justice Minister regarding progress with the Mental Capacity Bill. The committee has written separately to the Health Minister to seek an update on the timetable for the bill. Would members have any comments at this stage?
Yeah, Chair, I mean, members can see where this came from. I raised it, I think it was last week, and we did agree to write to the Minister. Disappointed we haven't had a reply, but this is what I feared, that there would be, it's not our fault, it's your fault, between the Health and Justice Department, and that's what we do not want to see. Simply to look forward to the response from the Minister of Health, given the response we got from the Minister of Justice, who quite clearly says that what Mr Crooks has said was not quite correct, and I'll go no further than that. At the end of the day, we want to see this mental capacity bill go through before this Assembly mandate is over. It's up to everyone to cooperate and make sure that that happens.
Okay, thank you for that, Kieran, and I think my members would agree. It's It's the biggest piece of legislation that the Assembly will tackle. The Minister, the Health Minister, did indicate during the week that issues had been resolved with justice in relation to this, and it seemed to be in a position to move forward. But I think we need to seek that clarification in writing as to how that's been progressed.
I'm interested in what you're saying. Has he withdrawn his accusation that the Minister of Justice was holding the bill up? Because that's what in fact he said, and it didn't go down too well in some quarters.
Especially the Minister of Justice.
Well, I mean, I'm not here to speak, defend or speak on behalf of the Minister. I'm just simply relaying what he referred to at an event this week, where issues had been resolved, and that's where it was at.
I am inclined to ask for an apology in the floor of the Assembly. Well, no, but it's reasonably asked, because if somebody makes a statement that is not quite in keeping with reality, surely someone is bound to retract or apologise for whatever.
Well, I think that's within any member's gift or right to do if they so choose. That's that course of action. I'm simply relaying the comment that was made during the week. But I do agree that we need to get clarification in writing on this as we move on.
Okay.
Okay, members, under correspondence, which is item 10, item 10.1 on page 74, is a letter from the Minister providing the committee with a briefing paper on the department's finance. And in relation to 2014-15 at this stage, the department is facing a funding gap of 160 million. In relation to 2013-14, the department has had a deficit of 115 million, which they've had to carry forward in the financial year. They hope to be able to get this down to 14 million, as suggested in the paper. Officials will be given evidence to this committee on the June monitoring round and on the 2013-14 outturn, and that will be at the next meeting on the 29th of May 2014. So the members at that stage will have had an opportunity to reflect on that and raise finance issues at that meeting.
Yes, Madam Chair, I've tabled this for discussion with the Ministers, you know. Am I not right in thinking that Julie Thompson would normally have come before this committee in February? In fact, always came before this committee in February just to outline what was happening at the end of the current financial year. Did I miss something?
Chair, from memory, I don't think there was a February monitoring round this year. I need to double check that, but I think maybe the monitoring round dates changed, so that may have been why.
She was here in December.
Yes.
That was the only monitoring.
But the benefit of that monitoring round was that Julie would bring us right up to date as to what was happening within the overall budgets of the department. And you know, we always used to laugh that she always said it was gloomy and doomy, and then she came in February and told us that she's got a rabbit out of the hat and all was clear. This year she didn't do that, and I'm just wondering, was that because we missed inviting her, or what happened?
Chair, I mean, I think that she did that. That was as part of the February monitoring round, and I don't think that there was certainly any intention on the department's part of not coming before the committee or anything like that. I do think maybe it's just because of the way the monitoring rounds are structured now.
But of the dates now for monitoring rounds, January, June and October?
Yeah, well, that doesn't actually fit neatly as to finding out what's happening to the overall departmental budget. Now, we've discovered there's 121 million and they're hoping to get it down, but that we discovered now in May.
Well, I think, well, we should rectify it. If we're out of sync with that, we should rectify it. But are members therefore content that on the 28th of May we will have the opportunity to reflect directly with the officials on these issues? Okay.
Yeah, Chair, I mean, I just want to put on record my very extreme concern about the way we're going in relation to the deficit. They were carrying the deficit of 115 million into next year. And the papers that we have in front of us are stark in some, well, the implications for to get on board is very stark. I mean, there's a number there. Impose additional charges for services, impose constraints on HSC staff. I know already how they're reacting to underpayment, reduce the range of standards of service offered. All those are dramatic cutbacks, to be honest, brutally honest, unless something is done to get the funding correct. And I just want to put that on record. Yeah. If we're facing more cutbacks, according to those there we are, something has to be done.
Yep, thank you for that, Kieran. I mean, I'm sure every member would share those concerns around the impact that that will have to the delivery of health and obviously, of course, in terms of our current issues within the health service. And I think one of the big pieces in this as well is the transitional funding for transforming your care. And, you know, where clarity on that, where it is, how it will be implemented, and you know, will we see the outcomes that we need to? But you're quite right to raise it here, and we will. Obviously, I would think members will take time to raise this on the 28th of May directly with the officials as well in terms of answers. So can I ask members to note item 10.2 on page 84. Page 86 also is a letter from the Minister about proposals to amend the Health and Personal Social Services Act. And there are two key issues involved. The first is the workforce regulation carried out by the Social Care Council, and the second is social work standards. Public consultations have already been carried out on these issues, and the responses were positive. It will mean bringing a bill forward, and the Minister is in the process of seeking executive approval to begin drafting the legislation. You can ask, are members content to schedule a briefing on the policy proposals to be contained within the bill?
Great.
Thank you. I'm asking members therefore to note items 10.4 to 10.8 on pages 88 to 104. On page 111 is a letter from RCN responding to the issues that were raised by Tiny Life about health visitors' awareness of issues connected to premature babies and their development. The Royal College of Nursing state that it recognises the importance of addressing these issues and will be raising these at the next meeting of the Central Nursing and Midwifery Advisory Committee. So I think that's, you know, that's been useful that that issue has been highlighted to them. So can I ask our members content to note this, and we'll copy the letter to Tiny Life who raised the issue.
Great.
Thank you. Page 113 is a letter from Pancreatic Cancer seeking a meeting with the committee. Again, are members content to invite the charity to the next stakeholder event?
Great.
Chair, I think just quickly reading over their letter there, we are aware that pancreatic is kind of similar to ovarian and very, very poor, incredibly poor survival rates, around 2% they're saying, so I think it'll be fully appropriate, and I suspect actually that could be pancreatic could be one of the other cancers that hopefully will get a good place in the overall awareness campaign for cancers in general.
Okay, thank you, Pam, for that. Item 10.11 on page 114 is a letter from the Eating Disorder Association about changes to GP contracts affecting blood monitoring for patients with eating disorders. Can I ask our members content that we write to the department about this matter?
Right.
Ask the members to note page 115 and page 116 is a letter from Prostate Cancer asking the committee to sponsor an event in the Long Gallery on the 3rd of October 2014. Are members content to sponsor?
Right.
Page 9 of the tabled booklet is from the Committee of Employment and Learning in relation to the Work and Families Bill. They're taking evidence on the committee stage of the bill, and the bill impacts on the Department of Health, particularly in terms of fostering and adoption, pay and leave. So I'm suggesting that the committee writes to the department to ask if it is content with the provisions within the bill that affect it.
Great.
Okay. Item 11 is any other business. Do members have any other business? No. Date, time and place of next meeting. There will be no committee meeting next week due to the European and Council elections. So the next committee meeting will be on Wednesday the 28th 28th, is that 28th of May 2014, starting at 2 p.m. in the Senate Chamber of Parliament buildings. Okay, thank you. I'm just going to inform members that we are going to move into private session just to discuss the evidence taken on the review of waiting times.
This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room